Morning, Michael. How are you? Morning, everybody. So, sadly, we have to report two more Albany County residents passed away last night. A man in his 80s and a woman in her 80s. And there was one death reported yesterday, a woman in her 50s. My condolences and prayers go out to all three families. And again, it's a difficult time to lose anyone to COVID-19, but in these difficult times to say goodbye to someone in the ways we used to. So please take a time to take a step back today and really think about these families and the 194 families this is unfortunately has happened to. It's tough times. As of today, there's 9,284 cases of COVID-19 in Albany County. That's an increase of 221 positive cases since yesterday. The day before that, we saw an increase of 161, which we probably figured was being closed down on Thursday from the snowstorm. So that number dropped down. The day before that was 178. So unfortunately, Dr. Whalen and I were correct. We're going to be well above 200, especially with Christmas upon us and other holidays. There are currently 3,197 people under mandatory quarantine. Of those, 28 have had close contact to a positive case. 5 were healthcare workers at a resident or group setting. 188 don't have a clear source of infection at this time. Over the last 5 days, there's been an average of 200.4 new positive cases each day. The day before that, it was 197.2. As of today, 31,518 people have now completed quarantine, which is also good. So we do try to put the positive stuff out with the other information that we get. I know it's a lot of feedback we get on Facebook about that and other questions directly at my office. Look, we just got to put the facts out as we see them to let people understand where we're headed, what direction we're in. And yes, people do recover from this, which is awesome, even before the vaccine. So we have now, though, out of those, 7,679 tested positive for the virus have recovered. 216 recovered since yesterday, which is good. The other alarming thing is, though, we're seeing the record amount of people go into the hospital. We had 14 new people administered into the hospital, and again, it's that numbers we have to watch. People go in, people come out, but it's alarming the amount of numbers. There are now 113 people currently in the hospital. Yesterday it was 114, so we're down 1, which is good, but it's still one of the highest we have had since this virus started 9 months ago, is having 113 people in the hospital. So we have to watch that since the outbreak of this started. The governor released the state's hospitalizations number on Saturday that showed the highest number of New Yorkers hospitalized since May 15th, which is concerning. So we are seeing that hospitalization for whatever reason. The way this virus is hitting everyone 9 months later, we're seeing more hospitalization, more people in ICU, more beds being used up, and it's alarming. Even though the vaccine's here, I tell people they got to be patient. We're going to get there, but it's going to take time. And you got to remember, when you get your first shot, it's 3 weeks till you get your second shot, so it's about 6 weeks before you know what type of effect the vaccine's going to have. 21 patients are currently in the ICU. Yesterday it was 21. So, and the day before that was 22. So down 1 from 2 days ago, but still our ICUs are at the highest they've ever been. We continue to monitor the Capital Region's hospital capacity. Like I said, Dr. Venditti is going to be on our control room tomorrow at 1400 to talk about the partnerships and the meetings they're having with all the hospitals in the region, how they can ship patients around if they get to a crucial tipping point where these beds start to get harder and harder to get in hospitals like Albany Med or St. Peter's. So right now, our hospital bed space has been stable at 24% or 25%, while our ICU beds space is now down to 30%. It was at 35 a week ago, so we dropped down about 5% for that when I last reported it on Saturday. We continue to urge people, please wear a mask, socially distance, cough into your hands, or your arms, your elbow, clean your hands, and we're going to get through this, but we need to be in it together in a partnership. So this will help us turn our numbers around if we continue to do the right thing. So everyone out there doing the right thing, thank you. I appreciate it. I know it's difficult, especially with the holidays, and who would have thought 9 months later, here we are, right? Actually, yeah, over 9 months now. So again, I know it's tough, so please do continue to do this and we'll get through it. If it's possible, get tested. Even if you don't have signs and symptoms, we're encouraging everyone to get tested that can. And the other issue that we've had, and we've talked about this today, before, people come out negative in the beginning. I brought up that girl, Jenny, who quarantined because her brother got it, so she had a quarantine for 14 days. 3 days before her quarantine ended, and she got tested beforehand, she was negative. She was positive, at the end. And I'm like, sorry, it's another 14 days. You got to stay in. I mean, it doesn't start from when you first start. It starts when you get your negative test. That's when your 14 days starts. Even the people that are doing the right thing. So that's like 28 days almost, where she has to self-quarantine. Not easy. I get it. I really do. Some good news today. I went out to the nursing home this morning when they delivered our first vaccines coming to our residents there. So it was awesome. Walgreen was out there on time and delivering this first shot to our residents. And I have reported before, our workers were not going to get the shots for some reason because we couldn't get enough vaccines. But they have delivered enough where we can get some of them done. And, we have roughly about 172 residents out at our nursing home. 150 have agreed to take the shots. The other 22 either have not, or they have healthcare proxies, and we have to get a hold of the people that can make that decision for them. We have roughly over 200 workers. Out of that, we've had 100 agree to take the shot. Other ones are waiting to see whether or not they want to take it or not. So, which is good. Again, it shows that we have to even educate our own workers and our healthcare workers that are on the front lines, and we have to get everyone to understand that this is the way we're going to get out of it, is by getting everyone the vaccine, and slowly we can get rid of the mask and have to socially distancing. But again, it's going to take time to get there. But I do want to say to the residents and workers, thank you for everything that you're doing. I can't appreciate enough what you're doing. So again, thank you. And so we also, unfortunately, we saw the agreement got hammered out by our leaders in Congress last night for the roughly $900 billion COVID relief package. Obviously, I have mixed feelings about it. It's something that I want to say to NISAC, Steve Aquario, Matt Chase from NACO, Mike Griffin from County Executives of America. We hammered out and kept hammering out, and I spent my whole Easter, we literally were on the phone for 18 hours trying to hammer it out, trying to get relief to the counties and towns and villages and cities. And it worked, but then the package stalled. And literally the package that they're passing now is the same one from the summertime that Mitch McConnell came up with. They critiqued some of it, and I want to say this, we're still reading through it all. We're still trying to figure out all the small print and all the add-ons that they like to do, so we don't exactly know where everything's at. I just had meetings with them 3 respective gentlemen this morning, talking about, actually real early this morning, talking about how this is really going to affect us going forward. But some of the things we did figure out was it's a weekly increase of $300 for unemployment benefits, a relief check of $600 for lower income Americans, nearly $300 billion for paycheck protection programs for businesses to keep their workers on board, which is good, funding for additional testing and vaccine delivery, and billions for schools and colleges. I know the sticking point for some of the schools was the private school aspect. I don't know where that ended up working out. I know that the Senate Republicans wanted to give $5 billion to private schools. The Dems did not. So I don't know exactly where that came out in the wash, so to speak. And funding for performance venues like our Times Union Center, Palace Theater, the Egg that we've been advocating for, went on so they're going to have funding in this. Airports are getting a second bailout. They're going to be getting more money in this too, on top of the $15 billion, so which is good. And some of the other stuff besides what was in this package, we found, early on we got like a $900,000 check from the federal government for our nursing home. I think we're going to get another one roughly in the same area, but this is separate from the bill. So, but I do like to thank Congress for what they've done, but we need more. It's what I talked about early on. I had this feeling, I said this back in April when we got the last stimulus package, that basically I wasn't banking on anything till March of 2021 until we get a new president. So till the president takes over and gets everything in play, we're probably the earliest looking at for the relief that the state of New York needs, the governor needs, and the counties and cities and villages is then. That's why I made the conscious decision to give an early incentive to let workers retire or leave service, cut our workforce, trimmed all the departments that I could, and delivered a balanced budget without waiting on this relief, because I knew then we weren't going to get what we needed. So hopefully we get it for next year, because things, a lot of state and federal programs are based on this stimulus package. As we know, the state of New York's probably roughly $24 billion in the hole, $12 billion with MTA, and the other 16 or 15, caused by this virus, or 6.7 before the virus, and then after that. So these are challenging times for the state, and unfortunately, they have a habit of pushing things down to us on the county level. So we have to be wary of that, and it's going to affect our program. So I just talked to Chairman Joyce the other day about this, that it's going to be difficult decisions we are going to have to make mid-shift during the budget process if the state decides to push more stuff down to us. So I want to remind people, you can't tax your way out of this. But the issue is that if we do raise taxes and you go above the 2% cap, some of the things a lot of people did not read when the Senate and Assembly passed this last year was that if we go over the cap, we lose funding for raise the age, no bail bond, all that stuff. It's tied in. Our cap on Medicaid, which is about $28 million, we lose all that. So if I go over the cap to plug this hole that could be caused by the state government, okay, then I have to plug the hole of all these other things that they're going to take away. So it's going to be tough decisions. I'm hoping that the Biden administration and Harris administration do the right thing and get this relief package, but our budget, our state budget, as you know, is due April 1st. So these are things that we have to stay on top of and work with, and it will be challenging. So I'm hoping that President-elect Joe Biden and his team start working on this package deal, and the House and Senate do the right thing. And again, this isn't about party affiliation. This is just about getting the relief that people need to continue to move forward. So please do the right thing so we get through it. So because of Christmas, we're going to be slightly adjusting our schedules for testing sites with the Whitney Young. Testing, again, will be available at the Times Union Center on Monday and Thursday this week. On Wednesday, the Whitney Young Waterville Administration Building will be doing it. Testing requirements and appointments for the Whitney Young, if you don't have insurance, and I'll say this because I still have people say they can't afford it, please go to UAlbany. It's free. We're free if you don't have insurance, and what you pay for the most part is whatever your copay is. And I haven't heard that if it doesn't cover it or does not. But the number is 518-465-4771, and then UAlbany, as always, 1-888-364-3065, and Price Chopper, CVS, Priority One, Walgreens, CVS, Urgent Care. I could go on and on and on. Please go to albanycounty.com, and you will see the times. They're there. It's a click away. I know you got to be patient. I know there was a shortage of the rapid testing. That was the answer we got back. So many people were using it in other areas of this country that they had a shortage of that. Now they're starting to get that back on, and you'll see these places back up and running with the rapid testing. As always, please remember mental health support's available 7 days a week, 8 a.m. to 5 p.m., and that number is 518-269-6634. Our 24-hour sexual assault hotline number, as always, 518-447-7716, and our 211 in our New York State hotline. Look, we've gotten a lot of calls about shutting down. We talked to people. I know under the old matrix, we would be in the red zone and we would have been closed in a lot of areas. I said this at the beginning of December, knowing what we were going into. We have less than 48% of the workers here in the county working. We have essential services we have to deliver. It doesn't matter what's going on in the world around us. We're under federal and state guidelines that we have to deliver, and that's like HEAP or food assistance or housing assistance, unemployment assistance. I mean, and children, youth, and family are dealing with kids for placement for neglect or foster kids or whatever it may be, mental health for children and adults. We can't just shut down in them agencies. So we have scaled back and we'll continue to scale back them operations. I said to the downtown business owners, to anyone that can, please scale back, go back down, slow it down, help us slow this virus down, because if we don't slow it down, the vaccine's not going to be here for a while. Not everyone's going to have an opportunity to go get a shot. I've seen the way it's going to be rolled out, and the way it's going to be rolled out, it's going to take some time. It's going to take time to get to the people that, that are under age 65 to begin with. It's going to take time to get to different age groups. You're like phase 5. If you're healthy, and you're at phase 5 of this. It goes phase 1, 2, 3, and 4, and then 5. So that's why I kept saying, I am not trying to deliver bad news. We're looking at September before we get back to some type of normalcy by the time this rolls out. And it's going to be banked on how many people decide to get the vaccine. So if we don't do a better job educating people and getting that message out, and people decide not to get it, it's going to stay here. And what's scary is I'm looking at that new strand that's happening in the UK. As this continues to morph and go around the world, are we going to be fighting this for some time? I don't know. But please remember, it's a marathon, not a sprint. We're going to get through this. We will get through this. We're resilient, and please work together in a partnership to solve the problems. Let's not create them. And if you got answers to the problems, by all means, call my office, 518-447-7040. Email us, Facebook us, whatever you want to do, and we're in it together. So if we're doing something wrong, or you see something that could be right, great. I'm not going to argue the science. I'll leave that to the CDC, the World Health Organizations, all the health experts that do this, and we just take guidance from them, So again, let's roll up our sleeves and work together. Please be safe, wear your mask, stay healthy, and any questions?
So the vaccines brought to Shaker Place today, when will they start actually giving the patients?
They actually started this morning. So I went out there today to, for a variety of reasons, but one to see it getting delivered, and the smiles on just not the residents' faces, but the workers. It's been a long 9 months. When I tell people, when you see people working, our hospital staff, our nursing homes, agencies like that have not had a break in 9 months. Just because when we shut down doesn't mean we can shut down the sewer plants, or DGS workers can stop plowing streets or picking up garbage, right? Where do people think something is just going to disappear? So people still have to work, but no, they started at 9. Actually, they got there ran a little bit late. They're supposed to be there at 9 o'clock. They got there about 10 after 9. It's got established and set up. So the first shot, I believe, started about 9:30, 9:40 today.
Do you know anything about the first patient who was given it?
Yes. So we with their permission, they're taking. I don't go into nursing homes, so I went into the new nursing home. I stay out of the one currently, for obviously because I shouldn't be able to walk through there either. Because you have to have a current, which I do. I usually get tested once a week. That doesn't matter. Families can't go through there. I shouldn't go through there. I usually go in the hallway. But I went into the new nursing part of the nursing home that's going to open up next week. But yeah, so we asked to take pictures. Sorry, yeah, we asked them to take pictures, and we'll share that tomorrow if we do a briefing, if we have to, or we'll just put it out tomorrow or today.
Also, you mentioned that the workers won't be getting the shot right away. Did you say when they're expected to start getting it?
So I want to say, I'm going to mess this up too, because I just met the gentleman today. He's like an epi person out at the nursing home. For whatever reason, they didn't give us enough vaccine for the workers. And I said that early on, which was alarming. So we talked to the federal government. They did. He got enough. And there, like I said, we roughly have a 250-bed facility, but we're running at 172 because obviously with COVID-19, people aren't going to nursing homes. People are keeping their loved ones at home. So out of that, only 150 wanted the shot so far. And that left, they gave us like 320 vaccines. So that gave us an opportunity to give it to the 100 people that want to get the shot out of our 200-something plus workforce out there. So we're working on that, and again, what we're hoping within 6 weeks they'll all be vaccinated, and the ones that didn't want it, we're working with, we're educating, and trying to get them to get the shot.
Are there any other doses of the vaccine going out to other places? I know that's like the one county nursing home, but any other places that you know besides the hospitals that it's being rolled out at?
Well, it should be hitting every nursing home right now as of today, this week. So every nursing home in Albany County and actually in the Capital Region should be getting the shots done this week, so which is all good news. Because unfortunately, we've seen that population get hit the hardest through this COVID-19, the ones that have unfortunately fell victims to COVID-19. So the sooner we get them vaccinated and the workers, that hopefully will slow our numbers down with people passing away from this. So, and then it goes into phase 2, which that's what we were kind of explaining a little bit yesterday. Dr. Whalen, our health departments, any county health department that's running New York State or New York City's health department has the medical corps, but they do practice mass vaccines, and they do practice a variety of other things. This is one of their core missions. They've been practicing this for over 50 years. So there's a whole plan that we have submitted to the federal government and to the state, DOH. But unfortunately, they're going to use hospitals as their regional hub. So really, Dr. Whalen and her team are going to be doing this because they've never taken this task on, and it's not their task. So we'll be working with them to help them get the vaccines out as it gets to phase 2, 3, and 4 as more comes in.
Good morning.
Good morning.
Stephanie Rivas, News 10. I wanted to start off by asking, what will this mean now that residents are getting vaccinated? What will this mean for visitations? Will there be any protocols for separating those groups of people?
So, awesome question. And I talked to the nursing home director, Larry Slacky, about this. It's regulated by the state, but you're right. Within 6 weeks, we can separate our nursing homes big enough. We have it set up now. As we have a whole wing just for COVID, and we got the new ventilation systems in there and purifiers. So we could, and we're going to have to push that up to the state once everyone gets vaccinated. But like I was saying, not every resident and worker is doing that. So we're going to mathematically have to divide them. But it was a quick conversation, but great question.
So you think people will be able to come see their family members who did get vaccinated at some point?
Within 6 weeks, I hope that then the state, as long as it's taken and we can divide it up, like I said, yes, absolutely. It's long overdue, but for good reasons why we have shut our nursing homes down.
And then when it comes to just double checking those numbers from today, you said there was 320 of those first doses that came in, but did all of those go out today, or is that going to happen throughout the week to residents and workers?
So that all went out today. So they're all out there today. They have today, tomorrow, Wednesday to get everyone, because it's 3 different shifts. So it's going to take a little bit of time, but everyone that has wanted the shot will have it completed. I'm hoping it'll be completed by tomorrow, but we'll just say Wednesday to be on the safe side.
Great. And then my last question is there any type of protocol for consent when it comes to nursing home residents with dementia or Alzheimer's?
Yeah, that's why that was the number. I forget, someone asked me this. That's why I got into. I was like, it was a great question. How many residents are actually going to take it? So out of the 172, 150 either could say yes on their own, or we got to their caretakers. So it's they will be up to their sons or daughters or aunts or whoever it might be, who's their proxy, that has to give us the okay to give them the shot. So either some have said no, or we just haven't been able to get the person carrying their proxy to sign off on it.
And then going back, following up on your question about the first resident who received it, was that a volunteer? Did they willingly say, I want to be the first person, or do you know about that?
I do not. I said who's going to be the first one, and please take a picture, and so we can share it with everybody. So I do not know.
And how do you feel about this happening today, right before the holidays?
I feel it's like an early Christmas present, to be quite honest with you. I see the struggles on the faces of the workers out of the nursing home, and the families that can't see their loved ones, and the ill effect this has had on our residents up there. So we had to shut it down. It's been a long 9 months for them, and it's awesome to know within at least the next 6 weeks, they're going to see the light out of the tunnel quicker, so people can get there and see them.
Thank you.
Any other questions?
Thank you. For the 320, that's the first round. Are you expecting another 320 coming in the next 3 weeks? Is that how it's going to be working?
Correct. That's how it works, because you need 2 doses within 3 weeks of each other, so that will come in, and I'm hoping, listen, I would love to keep the extra for the workers just in case they change their mind, or them residents, but they, it's controlled by Walgreens, goes back with them, and probably be pushed out to other areas that it's needed.
Was that Pfizer, or is that the Moderna that was rolled out over the weekend?
Pfizer.
Okay.
Pfizer.
Do you know when that Moderna will be available?
Supposedly it's supposed to be available this week or at the end of this month. I got quick approval from the FDA, so it should be rolling out. It's probably coming into the state as we speak. It's the Yankee hat. That's why he skipped you.
For the nursing home residents who do not want the vaccine, do you know why? Does it have something to do with the trust and the speculation about whether or not there are ill side effects? And if so, how do you bridge the gap between those who don't think it's that effective and those who do?
It's to educate them, and that was one of the questions I had today. Were the ones that said no, were they capable of saying no on their own, or do we needed a proxy? He didn't exactly know how many out of that 20 were in that situation. I said I'd like to know to break that down, because I figured someone would ask that question, and I wanted to know too. And it comes down to education, and even for the workers, I was surprised that work at our nursing home. I mean, we had over half say no, and they were getting tested twice a week. Now they're getting tested once a week. And I don't know if anyone out there has had that thing shoved up your nose. It's not a great feeling. And I was surprised that some of the workers didn't want it. So that was more alarming to me than the 20 residents. So we have to make sure that, again, we educate people. And some are afraid of the side effects, or not thinking it was rushed out so quick. What's the long-term effect this is going to have on me? And that we have to educate better.
Is the fear of side effects the primary reason that those who didn't want it didn't want it?
Correct. Some of the workers, yes, but not the residents. I do not know. I should know tomorrow, because I want that question answered myself. The workers, I was just being healthcare workers. A lot of them are RNs or LPNs or certified nursing assistants. Was the bulk who said no. Maintenance and some cleaners and stuff like that. I kind of got a little bit more, but I didn't. The ones that are on the front line. Obviously. If we get every resident vaccinated and everyone, and we still have a core of 20 people that don't want to get this, we got to be, it's going to be harder as we go forward not to keep that infection out of the nursing home.
On a similar note, there's been conversation for at least a month now about making inroads into the inner city and the black community because of a significant lack of interest in participating in anything public health related. How, if at all, have you been able to bridge the gaps between the community and the service?
So it's going to be difficult. Look, we're one of the first counties in the state to set up mobile testing, walk-up testing for these communities, and we couldn't get buy-in from a lot of people. We talked to the pastors, Albany Housing, you name it, the clergy, the elected officials, and we were trying to get buy-in, and it's going to be very difficult. It's one of the questions that the Black Caucus has. Bill Clay, I talked to Baroa, talked to Wanda Willingham, so we're going to try to put out some public service commercials to come out in the next couple of days and within the next couple of weeks to really address issues like this. Another big concern they brought up to me was a lot of people don't have doctors, so they don't even know how to get on the list to get the vaccine if they want to get it. And if they have underlying health issues, how does anyone know about them if they're not seeing a doctor? So all great points that Wanda brought up, Baroa brought up, and Bill Clay. And we have to address, and we have to get buy-in from the community, not just the leaders, but the people there. And that's why I had the doctor from urgent care or Medcare, I believe, if I'm saying that correctly, the one from Central Avenue, and he's going to come in and help us out with this to go into these neighborhoods to show that he's getting the shot and that everyone should get the shot.
And if I can take you back to August, things were actually looking up back then. And that's when we had the announcement that the Albany Empire would be coming back this coming spring. Things are not looking great right now. It's pretty clear that the TU Center is not going to open for regular business for the foreseeable future. Vaccination at the earliest is happening in June. That being said, is there any sort of prediction you can make about whether or not play will actually start in April as anticipated? Because it frankly doesn't look great right now.
I think they will. It depends on the crowd, right? It depends on how much vaccine gets out between now and then. You got football playing, all these sports going on. We actually have, hopefully, a good, huge announcement about another franchise coming here to the TU we're working on. But there's some great excitements. And one thing is, all our favorite, either be it rap or country or pop or whatever you listen to, they need money. So they're dying to get out to start touring. And it's the first time we've had major stars said, hey, I'll play to 4,000 people, you know. So, which is great. So, but I agree with you. I think our arena is going to stay vacant. This bailout that the federal government, I should say stimulus package, I got yelled at for saying bailout the other day. Stimulus package that they're delivering to everyone will help the TU and keep it going until then. But I'm thinking you're right, April, summertime is when you're really going to see everything open up again.
And will the restrictions for the third-party vendors as it relates to local restaurants be enough to sustain the restaurants through this winter?
You know, that's why I listened to them, and, you know, I was hoping the Senate and Assembly were going to get together quicker, you know, because I talked to Assemblyman John McDonald, Pat Fahey, and Assemblywoman Warner, who really were on top about this third-party restrictions we put on at 15%. The pirating that some companies do online to these companies, when you think you're ordering from your favorite restaurant and you're really ordering from this third-party app that it's not the owners, and then they charge you their fee. So we passed that, and I'm hoping that helps in the new protection they're going to get out of this bill, helps them carry on. But no, there's, you know, I'm telling people I don't want to see you out dining, but I want to see you ordering. You can order from your favorite restaurants. You can support them. You can support their workers there to keep them employed, but do it safely. And no, I think it's going to be a tough summer. It's going to be a tough winter where they're, you know, some of these places will not reopen up.
Do you ever see this vaccine being mandated for the nursing home employees?
You know, that's a great question. I hope we don't. I hope we can win them over with education, and you know, I don't want to mandate any vaccine to anyone that doesn't want to take it. But people have to realize if we want to move on in life and get back to some type of normalcy, everyone's going to have to get the vaccine. But we have to win them over through education, sit them down, find out what the problem is, or this is going to go on forever. But to force someone, no, I don't think that's a good play from government to force anyone to say you have to do something you don't want to do.
Do you see any more restrictions coming in the near future with the increase in cases, and if so, what might they be?
I'm going to put up in the control room on Tuesday. I'm not looking for a shutdown, but I'm looking for a slowdown. I think that we need to, really, people should stay off the streets if they don't have to. I'm not advocating for a curfew or any of that stuff, but we have to look at this. Our numbers are going through the roof. The vaccine's not going to get it to everyone, and you know, so January is going to be rough. I mean, December's been rough. November was rough. I didn't think December could get any worse. And after this holiday and people planning on traveling, and people feeling that the vaccine's here, they can go out. It's scary. And you know, lockdown has a lot of bad effects on people with addiction or suicide. I think the suicide rate went through the roof. Addiction, they had. I was just reading on CDC. Don't quote me on this because I was reading it last night and it was bothering me that they saw 81,000 more deaths as of, you know, like May of 2020 versus in 2019. They do it from 19 to 20, but it would have been 18 and 19. It's scary. You know, you see the other effect it has on people with the drug use and the fentanyl that's being utilized. So, but we need to, and I'm going to encourage through the control room that look, we need to slow down more. We have to, or it's just going to be a brutal month for us ahead of us.
Okay. Based on what you're saying, you have a lot of faith in this vaccine. Do you know when it might be available to you, and would you actually be willing to document your experience with it, like from when you get it, you know, any after effects that it may have like a camera crew or somebody follow you around after the fact, because you want to instill confidence in the community, and I think the best way to do it might be through you and possibly your family.
As long as it's Daryl not following me around. I will say this. I'm still in the New York Army National Guard, so I could get the shot that way. I will not. I feel that, I want people to have confidence, and if people want to see me get the shot when it's available to me, when I fall in that category, I'll only take it if they think that I should take it to show that it's safe, and the point that you made. I think as leaders, we have to get it to the people that need it first. Our nursing home residents, our workers, our hospital workers. We have doctors. I just got a great question from a doctor who called my office yesterday, who I used to see, so I got a little nervous. I'm like, what the heck's he calling me for? But I picked up the phone and I talked to him, and he's on the front line in his office doing stuff, and he's like, when do I get the shot? So I'd like to go to the people that are essential first. I'm not saying I'm not essential, but I want to see the EMS workers, and I want to see the hospitals and all the first stops and the medical facilities that we visited around the county get the shots first, because they have to take care of us. If we get, God forbid, we get sick. So I don't know. I got mixed emotions about it, because my staff asked me the same question. I go, I don't know if I take it. I think it's the wrong message. When Vice President Pence taking it, I thought it was awesome, because you had 74 million people vote one way. You have to convince them that this shot's okay. So I thought that was a good message to send, to say, look, I'm taking it. It's real. The virus is here. That's the way I read into it, and it's safe to take it. Everyone else, I don't know. It's a good question.
Last question. Where are you dumping all the snow?
What's that?
Where are you dumping all the snow?
On your street. In the Hudson River, it goes down to, in the city. In the hill towns where we plow primarily, it goes to the, goes off the side of the road. There's plenty of areas to go. And we also haul the snow away. So in our parking lots, we do have a lot of parking lots and areas we do clean in downtown Albany. And actually, we went into Watervliet and helped out Mayor Petroselli plow after the day after storm. So, having no other questions, please be safe and healthy out there. Do the right thing, and happy holidays to everybody.